Pregnancy can be a beautiful journey, but at the same time puts enormous stress on a woman's body. This stress can lead to cardiovascular issues.
So, preeclampsia is a condition which affects women who are pregnant, and typically they have elevated blood pressure.
Michelle Bartels, a patient of Dr. Mastour's, had two experiences with preeclampsia.
My first one was with my daughter. She's now 15, but I had her at 32 weeks.
Normally diagnosed at 20 weeks of pregnancy, the symptoms include high blood pressure, migraines, and protein in the urine. And Michelle had all of them.
For her, I was actually breached, which means that she was not in the birth canal where she needed to be born. So I needed to have an emergency C-section with her. About 6 months or so after I had my daughter, I was able to come off the blood pressure medicine, thinking, I'm okay, I won't have to worry about that ever again.
But she did have to worry again. 7 years later, the preeclampsia returned during pregnancy with her second child. Her symptoms improved after pregnancy, only to return again long afterwards.
I did not realize that there was a link between preeclampsia and long-term cardiovascular disease.
Once you've had your baby, a lot of women just walk away and think life is going to be fine. But unfortunately, if you've had preeclampsia, it puts you at additional risk of developing chronic hypertension.
It's important for preeclampsia patients to see a cardiologist because they're at increased risk of heart disease the rest of their lives. To help streamline treatment and communication between obstetricians and cardiologists, WellSpan has set up a postpartum preeclampsia follow-up program.
One of the parts of this program is to ensure that their pregnancy diagnoses is part of their medical record. Unfortunately, a lot of times pregnancy diagnoses are often missed when discussing health histories.
Many things can arise from being pregnant because it's so taxing on the body.
One way to look at pregnancy in general is it's basically like a cardiac stress test. So think of somebody who may have had cardiovascular symptoms. Part of their workup might actually be a cardiac stress test. In this case, these women have already had that.
The great news is normal lifestyles can be achieved in preeclampsia patients with proper intervention.
I'm able to do my daily activities. I'm able to play baseball with my son. I'm able to go horseback riding with my daughter. So I'm still able to live my normal everyday life.
Ed Russo, CBS 21 News.